services, and other community felt needs. We have noted with great appreciation the commitment in addressing of human development. We are not unaware of the ongoing support and collaboration with the federal government and our numerous development partners at all levels. It is our hope and aspiration that such support and collaboration will be sustained, maintained, and improved upon to ensure that these yearnings are addressed within the goals and objectives of our primary health care. We wish to reiterate our unflinching support and commitment to this cause, my dear ladies and gentlemen. We are grateful to His Excellency, the Executive Governor of Kano State, for making this achievement possible, the federal government, the Honorable Minister of Health, as well as our development partners for their numerous support and assistance in our state, such that we have that kind of feeling of being at home at any point in time. May I also, distinguished ladies and gentlemen, use this opportunity to express our gratitude and appreciation to His Excellency, the Executive Governor of Kano State, Dr. Abdullahi Umar Ganduje, for the honor and recognition bestowed on us to be the chairman and members of governing board of the state primary healthcare management. We appreciate it and we are very, very thankful, Your Excellency. I wish us a very, very successful and fruitful deliberation and journey masses to our various destinations. I would like to pray here that Allah subhanahu wa ta'ala to continue to grant us peace, unity, stability, prosperity, and tolerance. Thank you very much. Ladies and gentlemen, I would want to say something, but unfortunately there is a lot of problems with my timing, and I don't want to go on talking and talk rubbish. I thank you very much, distinguished ladies and gentlemen, for listening to this small brief. Thank you indeed.
Thank you very much, our traditional leader and chairman of the governing board of the State Primary Healthcare Management Agency. Distinguished ladies and gentlemen, quickly, in 2 minutes each, we shall take goodwill messages from the representatives of our development partners. May I kickstart the goodwill messages stage by inviting Dr. Bashir Abba, representing WHO, to please come forward and make his goodwill remark in 2 minutes. Please welcome Dr. Bashir Abba as he approaches the microphone.
The Executive Governor of Kano State, the Honorable Minister for Health, the Secretary to the State Government, the Honorable Commissioner for Health, the ED, National Primary Healthcare Development Agency, members of the State Executive Council present, our royal fathers of the day, distinguished ladies and gentlemen, good morning. Your Excellency, Honorable Minister for Health, Dr. Peter Clement, the officer in charge of WHO Nigeria, wanted to witness this occasion in person, but he requested that he represented because of the other exigencies that prevented him from witnessing this historic occasion. He writes, as we recall, the primary health care was heralded in 1978, and it ushered a new era in public health in which the healthcare approach reflected the broader WHO definition of health in not only addressing the disease or infirmity, but also the well-being of all individuals. The primary health care is rooted in a commitment to social justice, equity, and a recognition of fundamental right to the highest attainable standard of health, as echoed in Article 25 of the Universal Declaration on Human Rights. 40 years after, the primary healthcare approach is still the most effective way to sustainably solve today's health and health system challenges. The PHC approach is also foundational to achieving the goals of the universal health coverage and the health-related sustainable development goals, the SDG. Recognizing the central role the primary health care for achieving health and well-being of all, WHO supports the Nigerian and other state governments to identify priority areas for improving health, advocated for the development of health policies based on PHC and addressing other social determinants of health through multi-sectoral action. Kano State occupies a unique position in northern Nigeria and the country as a whole, being the most populous as well as a major commercial and cultural center. Therefore, strengthening primary health care in Kano State will immensely contribute to the achievement of the universal health coverage and the health-related SDGs. The contribution of Kano State is also recognized within and outside the country in the fight against polio. We want to commend the Kano State government for organizing this summit at this critical time, and the WHO will continue to provide technical and other support to the state in strengthening the primary health care and other priorities. In line with this reform agenda, and as part of the WHO Africa Regional Office reform, WHO Nigeria is also undergoing a functional review that will reposition the organization to support the country even better. In this regard, I would like to deeply appreciate the Kano State Ministry of Health and its agencies for the warm reception that was accorded to the functional review team that visited the state recently. We will look forward to the deliberation and recommendation from this summit with a view to support in the implementation of its action points. Thank you very much.
Thank you very much, sir. Next, Dr. Shamsu Sani, representing Bill and Melinda Gates Foundation. A round of applause for Dr. Shamsu.
Auzubillahi minash shaitanir rajim. Bismillahir rahmanir rahim. Your Excellency, the Executive Governor of Kano State, Dr. Abdullahi Umar Ganduje, Honorable Minister of Health, the Royal Fathers of the Day, the Emirs, duly presented by the district heads from the 5 Emirates, the Executive Director, National Primary Healthcare Development Agency, Honorable Commissioners, distinguished ladies and gentlemen, Assalamu alaikum wa rahmatullah. On behalf of the Bill and Melinda Gates and Aliko Dangote Foundations, I would like to extend our sincere appreciation to Kano State Government for being invited to this important event. This is a very critical milestone for the Kano Primary Health Care Program, and we're very delighted it is coming now and we are part of it. And it goes to show a very visible and sustained commitment to primary health care under one roof. The recently signed Seattle Declarations and Human Capital Development. Kano State is the first role model state for Bill and Melinda Gates and Aliko Dangote Foundation engagement. And this has started since 2012, initially in the context of routine immunization strengthening, then later on broader primary health care involvement. These engagements has been sustained in Kano with main focus around strengthening governance and management, financial administration, operational and data management. These two foundations are committed to be in Nigeria, and in particular also Kano, being a deep engagement state in the long haul, working with the National Primary Healthcare Development Agency, State Primary Healthcare Management Board and other agencies under the Ministry of Health to finish the job on polio eradication and ensure primary health care under our roof is fully implemented. This commitment will also mean we will support with data resources and other assets for states that show interest and commitment of resources to tracking revenue at the state level, and also in line with our existing partner base in Kano, we will continue to encourage other donors to consider direct funding at the state level. Your Excellency, these two foundations will remain committed to work closely with Kano State Government to ensure continued and sustained coordination of development agenda focusing on polio eradication, improving routine immunization, strengthening primary health care, and human capital development. I wish us a very successful and fruitful deliberation at the end of this event. Thank you very much, sir.
Thank you very much, sir. We appreciate your short and concise speech. May I now call upon the representative of CDC in the person of Dr. Tinuke Ahmed to please come forward for our goodwill message. Dr. Tinuke Ahmed, please.
A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. His Excellency, sir, the Executive Governor of Kano State, Dr. Umar Abdullahi Ganduje, please permit me to stand on existing protocol. On behalf of my national coordinator, Dr. Endi Waziri, I felicitate with the Executive Governor of Kano State and the entire people of Kano State on this auspicious occasion. Anybody in Kano State will know that the government has achieved a lot in primary health care development, and we are glad to be a partner in progress in the state. National Stop Transmission of Polio came into the state primarily with eradication of polio as focus, and the strategy used was strengthening routine immunization, which we have been fully involved with in the state, where we are present in all the LGAs in the state, in the 44 LGAs in the state. Sir, we are committed to continuing our support in ensuring that RI is strengthened in the state, and we're ensuring, where my national coordinator is informed me to let you know that we'll continue to be a partner in progress in the state. Thank you very much, and I congratulate the entire people of Kano State on this auspicious occasion. Thank you.
Thank you very much. Distinguished ladies and gentlemen, I want to welcome the delegation from UNICEF and will at this point invite Alhaji Isaka Diop, PhD, to represent this international organization and give us a goodwill message. Thank you.
Thank you very much. Good morning, everyone. Assalamu alaikum. I'm speaking on behalf of UNICEF, on behalf of the chief, but also on behalf of the OIC. UNICEF is highly pleased to participate in Kano PSC Summit. I would like to use this opportunity to premise the fact that as Nigeria is a signature of the SDGs and committed to the global push for universal health coverage, we are gladdened to see that Kano State is also taking on this bold initiative. The goal of improving health indices by 6% as captured in our SDG target requires broad-based effort, particularly at the subnational level. Kano is perhaps the most consequential state in achieving this. This is a premise on the unacceptable indices for child health in Kano. More than 1,505 children die every day. Children are mostly dying from preventable causes that are easily treated at the PSC level, such as malaria, pneumonia, diarrhea, malnutrition, and measles. Kano has the highest burden of children who are not growing well in Nigeria in terms of stunting and wasting. A broad-based, multi-sectoral and multi-partner collaboration centered around primary health care revitalization will ensure the health and well-being of Kano citizens is secured. UNICEF and Kano State government remain natural allies in ensuring every Kano child survives and thrives and in pushing forward the PSC agenda. There is therefore a need for continuous investment in procurement of ready-to-use therapeutic food for management of children with severe acute malnutrition, while we explore in the long-term interventions for prevention of malnutrition, including promotion of infant and young child feeding and other child survival activities. We welcome greater collaboration with both government and other development partners in the area of building technical capacity to strengthen PSCs across Kano State, generating evidence on the impact of PSC strengthening, work in creating social accountability for PSC service delivery. UNICEF wishes to felicitate with the Kano State government on this laudable action. We have been strong partners with the state over 3 years in advocating for PSC revitalization under the PSC per word agenda and PSC under one roof. We will continue to exhaust Kano State to embed its PSC revitalization process not only through physical rehabilitation or renovations of PSCs, but also strengthening enabling legislature, support PSC human resources for health, strengthening PSC data systems, ensuring PSC service delivery is appropriately linked with secondary health systems and community platforms. It is worthy to note that while huge progress has been made in the polio eradication and routine immunization effort, there has been more mixed results in other key intervention areas. The PSC platform offers the most effective means of sustained health gains. UNICEF is pleased to support the development of PSC action plans geared towards the rollout of Kano State PSC strategy framework. Together we will create a world where no child dies from a preventable cause and all children reach their full potential in health and well-being. Thank you very much for your attention.
Thank you very much for your presentation. May I now call upon Alhaji Garba Abdu, representing Clinton Health Access Initiative, to please come forward for his remarks.
Your Excellency, sir, the Honorable Minister of Health, my good friend, Dr. Faisal, all all other protocols duly observed. The Executive Governor brings you special greetings from CHAI, Clinton Health Access Initiative. I wish to congratulate you for this novel, this great occasion. This provides opportunity for a view of the entire PHC in Nigeria. It used to be Health for All by the year 2000, and we are in 2020 now. I think this provides an excellent forum to discuss the journey so far. Clinton Health Access, Your Excellency and Honorable Minister, is not new to you or to most other actors in this room. Has been in existence since 2007 in Nigeria. And we are playing a lot of roles in most of the significant areas of health. We always support the government, absolutely and completely. And we are always available to continue supporting the government of Nigeria and the government of Kano State. CHAI office in Nigeria is one of the biggest in the world. We have about 96 staff working with the federal and the state government. So far, all other things have been mentioned, but I would like to seize this opportunity to congratulate you and the Honorable Commissioner for creating this forum, and I'm hoping that this forum, I'm sure this forum will provide a way forward after looking at all the successes, the challenges of the program. Thank you very much.
Thank you very much, sir. Distinguished ladies and gentlemen, we are making steady progress into this very important summit. And it is at this juncture that we shall listen to the first paper presentation, The Role of Primary Health Care in Achieving Universal Health Coverage. The paper, distinguished ladies and gentlemen, will be presented by Dr. Mukhtar A. Gadanya. Dr. Mukhtar Gadanya was the youngest recipient of the National Honor of the Member of the Order of the Federal Republic in 2007. He has initiated a campaign to harness the goodwill of Nigerian youth for a successful presidency in the past. He is a recipient of several prizes and is currently a consultant public health physician with the Department of Public Health, Aminu Kano Teaching Hospital. May I quickly and most humbly invite Associate Professor Gadanya to please come forward for his presentation.
His Excellency, the Executive Governor of Kano State, Dr. Abdullahi Umar Ganduje, Khadim al-Islam, OFR, the Honorable Minister of Health, Dr. Osagi Emmanuel Ehanire, Royal Fathers, the SSG, the Honorable Commissioner for Health, donors and development partners, ladies and gentlemen.
Ladies and gentlemen, can we please maintain one hall? Please maintain one hall. We need absolute silence so that we can fully grasp the proceedings. Please. Do Allah dan saurara da hayaniya masu zirga-zirga su zauna wuri daya. Do Allah samu wuri a zauna.
Okay, assalamu alaikum once again, and I am presenting on behalf of my colleague, Dr. Akindele Olufemi Adebi. And as I was introduced, the title of my presentation is Primary Health Care as Catalyst for Universal Health Coverage. And Dr. Akindele Olufemi Adebi, my colleague at the College of Medicine, University of Ibadan, and is not able to attend because of flight cancellation. And my presentation is structured in the following format. understanding primary health care and universal health coverage. 2, challenges in the move towards universal health coverage. Linkage between primary health care and universal health coverage. PHC-based litmus test for universal health coverage. And conclusion. And I'm going to go on a historical lane very briefly to say what and how primary health care evolved. The earliest referral to primary health care was in the United Kingdom in the year 1920 by Lord Dawson in the document titled First Contact Medical Care and the Promotion of Primary Health Care. And thereafter, 40 years later, in Great Britain, primary care was then assumed to refer to general practice. But we know the pivotal moment of the alma mater in the former USSR in September 1978, where the walls of the nation, led by WHO and other development partners, decided to shift to a pivot and a focus which is going to effectively deliver health care for all. So the foundation for universal health coverage was not actually set in recent times, but was set as the Alma Ata Conference, which was the pivot to for the primary health care. So need to understand primary health care first. We know prior to the Alma Ata Conference in the former USSR in 1978, there was a dysfunctional healthcare system, the inverted care pyramid, in which you have 90% of the populations accessing only 10% of the overall care in terms of funds, in terms of healthcare workers. So you have most of the healthcare workers, mostly doctors, highly trained pharmacists, and nurses and midwives, only even available in urban areas in most of the developing countries. And there were gross inequalities between countries, which are persistent to the current date, but which have to a reasonable extent been reduced in form of equitable distribution of healthcare. And we know within countries too, there are inequities as to how healthcare services are available and as to what are the indices for morbidity and mortality. So who becomes sick, who dies, and what extent of healthcare available to individuals are still largely premised as they were in 1978 on where you live, what amount of income is available to you, including what gender you belong to. Because you know, in societies which are largely male-dominated, men decide a lot on the funding and decision to access care. And prior to the Alma Ata Conference, there was the concept of over-medicalization of healthcare. So the concept of every problem will need a pill. So if someone has a headache, you imagine he needs a painkiller. Every problem needs a pill, and every need needs a needle. So we end up conceptualizing human needs as largely being only addressable by pills and needles. But in reality, we know that a lot of psychosocial factors, social factors, including access to universal health coverage, are what can, in the short and long term, provide preventive, promotive, curative, and rehabilitative services. And we know prior to the Alma Ata Conference, there was a gross inefficiency in facility-based care. Cares were fragmented. Mothers could come to a healthcare facility needing to, for example, in the morning access immunization for a child, and then having to come back later in the day to access family planning services, and potentially the subsequent day to access health education. And prior to the enactment and the promotion of PHC at the Alma Ata Conference, most of how the healthcare system is delivered wasn't in a sustainable way. I'll come to discuss how primary healthcare supports sustainability based on its concept of community participation and based on its needs that healthcare services should be at a cost the country and the community can afford at every stage of their development. and emanating from the Alma Ata 1978 definition of primary health care, which, like we all know, especially the students, that primary health care, PHC, is an essential care which should be practical, scientifically sound, and socially acceptable methods and technologies, which is made universally accessible. And so from 1978, we were talking about universal accessibility. And then this is speaking back to the topic of primary health care as a catalyst for universal health coverage. And then the primary health care should be, like I said, accessible to individuals and families in the community. And then going to the need to ensure that care is at every stage of the development of the country and the population, and should be premised on self-reliance and self-determination, building nicely into the issue of sustainability. Still part of understanding primary health care, the Alma Ata document indicated it should form an integral part of the country's healthcare system, and should not only be an integral part of the healthcare system, should be its central function and main process. So at the core, and not as a cornerstone, but at the center of every country's healthcare system is its primary healthcare system. And then building on the concept of healthcare services and the healthcare system as not only social services, but they have manifest economic and developmental contributions to national and subnational entities. And building nicely to the concept of primary health care is bringing care to where people live and work. And we had a discussion earlier in the, before my presentation where the Honorable Commissioner was talking about building mega hospitals in all the Emirate Council in the state, which is part of the concept of primary health care, which is bringing care close to where people live and work. And primary health care has some universal principles. One, equitable distribution. You are moving from equality to equity. Equality would mean if I should come to a particular location, I distribute coatem to everyone, I give everybody nutritional supplementation. But it's not everyone in a particular community that will immediately need an artemether-lumab fantrin combination to treat malaria. And certainly it's not everyone who will benefit from nutritional supplementation. Some people will instead benefit from exercise therapy to reduce the overall calorie distribution in their body. And still part of the universal principles of primary health care is the issue of community participation, which I know is happening very, very well in Kano State. And the next principle is preventive and promotive approach. You don't only wait in your disease palace until when people are sick, they come to a tertiary, secondary, or primary health care, but you are proactive in that you go to the community, you offer promotive services, and you can be at the headquarters, and then enact policies and legislations which are going to be of health promotive benefit, and then preventive services like immunization, vitamin A supplementation, and other chemoprophylaxis. And then as a principle of primary health care, it should be based on appropriate technology and involve multi-sectoral collaboration. A lot of time people conceive health as being largely an issue only relevant to the healthcare system. Certainly we know the health is way beyond the healthcare system. How we train the healthcare workers in the educational institutions. So we have an element of the educational sector coming, and then the girl child education consistently is known that a girl with a secondary school education, irrespective of every other factors, economic, social, her issues are more likely to survive and thrive than a girl without a completed secondary school education. And the issue, increasingly important issue of security in our environment. We know how well we need security to deliver a lot of public health intervention outreach. An issue of agriculture, how it contributes to nutritional activities, infrastructure, how people are able to access or referral services, secondary and tertiary healthcare services. So as discussed, primary health care is central to health, and consistently as agreed as the Alma Ata Conference in 1978, PHC is the central and sustainable approach to health for all, initially by the year 2000, and now by as part of the Sustainable Development Goals and beyond. And primary health care fosters autonomy, justice, and beneficence. Universal health coverage means all people receive the care they need, comprising promotive, preventive, curative, and rehabilitative care. So it's not only one component of care. People who are sick should be able to receive treatment, and people who suffered from disability shall access, as part of universal health coverage, rehabilitative services. Key questions for universal health coverage in Nigeria. We look at our health indices a lot of time with lack of satisfaction. As one speaker earlier said regarding malnutrition in Kano State, but we need to put it in context. Kano State houses 1 out of 15 Nigerians. So every 1 out of 15 Nigerians is actually in Kano State. So if you are looking at our achievement, the achievement of Kano State, you are looking at effort made to address health needs of 1 out of 15 Nigerians. And then if you are looking at the indices of Nigeria, you are looking at indices and efforts made to address health issues of 1 out of 5 Africans. So the context is quite relevant. And we know increasingly for Kano State, our services, promotive, preventive, are reaching our contiguous neighboring states. No magic bullet to address all issues as to the nexus and synergy between primary health care and universal health coverage. Financing is key, but it's not the only issue. Needed are services reforms to human resources, medical education, medicines, and financing. And a good lesson is a lesson in integration. And I want to primary health care in Nigeria and implementation research, which found that integration is able to deliver, for example, using only a few thousand trained healthcare workers to deliver close to 3 million oral polio vaccines, and able to, in the same integrated manner, deliver close to 1.5 million deworming for kids under 5. So part of the key lessons for how primary healthcare and UHC should work, consistent from our evidence generated locally, is the issue of integration. And then second good lesson is the issue of aid effectiveness, key to which development and donor partners should align with national and subnational policies, strategies, and plans in terms of they keying into support in a concerted manner, programming and implementation of PHC and UHC services based on evidence to make policies and implement the policies. And we should be cautious that UHC is not only about spending, but it's about matching the spending to priority programs, population, services, and other evidence-based issues and decisions. PHC is our rescue way to universal health coverage, building on the earlier premises in which primary health care aims to, from the outset, achieve health for all. And at the heart of primary health care is embedded the universal health coverage, but we shouldn't make the mistake of medicalizing the health system, medicalizing every health issue, and inappropriate spending. Like I said, tremendous progresses have been made in Kano and Nigeria as a whole. Key issues to universal health coverage and primary health care, the basic health care provision, both basic health care provision fund, the primary health care under one roof, the reforms in the NHIS, and the MPSCDA trailblazing efforts are always toward achieving UHC in order to foster primary health care in Nigeria. And then primary healthcare efforts and UHC efforts should be based on genuine community participation with communities sharing in cost, in project efficiency, and at the same time increasing effectiveness of communities and building their capacity. And additionally, our efforts should be homegrown. This has been done amply in Kano State. For example, the Kano State Healthcare Trust Fund agreeing, based on a law signed by His Excellency, to provide a percentage of the state IGR and a percentage of the LGS allocation to the Healthcare Trust Fund, which is a locally homegrown effort. And then additionally to the Kano State Contributory Healthcare Scheme, which are homegrown efforts. And substantial efforts should be made to ensure adequate public health and primary healthcare workforce, including, for example, primary healthcare workers, PHC nurses, family physicians, midwives, allied healthcare professionals, and non-professional community workers. And the need to ensure non-defragmentation of the healthcare system. From the alma mater definition earlier discussed, PHC should be an integral part of the healthcare system, as should the universal health coverage. And as a summary, we should look at efforts to start from within. As in the famous quote of Jim Quick, if you break an egg from outside, you're actually meaning to only eat that egg and end its procreation. But if an egg break from inside as a result of its own maturation and its own experience, also central to, based on my discussion, achievement of healthcare coverage, its onset as the Alma Ata conference, the issue of health for all. And health for all is not only about financing, it's about policies and reforms, which we see have been carried out with massive and continuing success in Kano State and in Nigeria as a whole, with Kano State substantially contributing to addressing health need of 1 out of 15 of Nigerians, and Nigeria contributing to addressing the health need of 1 out of 5 Africans. Thank you very much.
Okay, that has been Dr. Mukhtar Ahmed Gadanya, an associate professor of community medicine with the Amin Kano Teaching Hospital, with the first paper as we stated. And you are watching live the 2020 Kano Primary Healthcare Summit, organized by the state government to showcase the achievements of the Ganduje administration in the development of primary health care services across the state. And it brought together stakeholders in the health sector, especially at the grassroots level, including medical doctors, nurses, community health, as well as heads of various training institutions and agencies that have role to play in improving the healthcare services in the state. And part of the achievements being showcased now are the ability of the state government to establish comprehensive health care center in all the 484 wards across the 44 local government areas of the state, and at least a health post in every community or hamlet that has at least 2,000 inhabitants. Okay. Koroso dances are entertaining the gathering. That is the cultural.
appreciate the Oroso cultural troupe. I'm sure the Honorable Minister, the antics displayed by the Oroso cultural troupe are not known in medical parlance. Thank you very much. Distinguished ladies and gentlemen, we are returning to the program proper. And it is at this juncture that I will invite for his remarks an erudite medical practitioner, an astute manager of men and resources, a very strong man, the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shuaib, for his remarks. Sir.
Bismillahirrahmanirrahim. The Executive Governor of Kano State, Your Excellency, Dr. Abdullahi Umar Ganduje, OFR, Your Excellency, the Honorable Minister of Health, Dr. Osage Emmanuel Ehanire, distinguished ladies and gentlemen, permit me to rest on already established protocol. Assalamu alaikum. It gives me great pleasure to be here today on behalf of the management of the National Primary Healthcare Development Agency. Only 2 months ago, we were here in the great city of Kano to congratulate His Excellency, the Executive Governor, and say thank you to all citizens of Kano State, because in the year 2019, the best performing staff at MPHCDA was a lady from Kano State. So you should be very proud of yourself, as we are very proud of Dr. Leila Umar. Yesterday, when we kept having postponements and delays in our flight, I had an engagement with the Honorable Minister of Health. He had a very busy schedule, but he still said, this primary healthcare summit in Kano is very important, and we must do everything to make sure that we get here. And that is exactly what we did. The Honorable Minister of Health, despite all the challenges, ended up arriving here around 11 p.m. Because we did not want to take a chance, we came by road from Abuja and arrived here at 1 a.m. That is to tell you how important this summit is. We'll be celebrating a polio in Nigeria because of the good fortune that Kano State has, because of the high-performing individuals that Kano State has. Here we are, 4 months down the line, and we're almost done. But this feat was not accomplished very easily. I was here for several months in 2013. Right under my nose, I saw how, under the leadership of the Executive Governor, you guys worked very hard to ensure eradication of wild polio virus in Kano State. I know very, very well how His Excellency, accompanied by the Serkinyaki polio, went from house to house with traditional leaders, ensuring that polio vaccination was accepted. So we are at a point in this country where if this was a war, there is no doubt that the heroes of the white polio virus war in Nigeria are His Excellency, the Executive Governor, and the Serkinyaki polio. I say this because you have to be very proud of the achievements of your leaders. Where you have forthright and visionary leaders, then you will have followers who will toe their line. And right before my eyes, nobody told me, I saw leadership displayed by these two gentlemen. I want to seize this opportunity to enjoin each and every one of you living here today to acknowledge your efforts. What the next 4 months means is that no child, nobody in Kano State will ever be threatened by the wild polio virus. It is a major achievement, and you should give yourselves a round of applause. The traditional institution, especially the northern traditional leaders on polio eradication, routine immunization, and primary health care, led by the Sultan of Sokoto, led the efforts of the traditional institution to make sure that there was acceptability of immunization and other primary health care efforts. Our development partners have always been there with us, and we want to say thank you for all their efforts. But at the point where leadership mattered the most, in 2016, when we had a reversal by the outbreak of white polio virus transmission in Borno, that is when leadership mattered the most. That is when Mr. President Muhammadu Buhari called the health team and said, I am sure that it's not just one polio virus that has been isolated. If you go to the trenches, if you go to the villages, you find more white polio viruses. And that is exactly what we did. We went to the villages, we went to the communities and found more white polio viruses. Not only did he provide us with the motivation that has brought us here today, but because Mr. President provided the resources, 9.8 billion naira, to ensure that we had all the financial support and the political support to end polio virus transmission in Nigeria. On routine immunization, in 2015-2016, Kano State was one of the worst performing states when it comes to routine immunization. But under the leadership of His Excellency, the Governor, Kano State is one of the best performing states when it comes to routine immunization. I want to again seize this opportunity to say thank you for the leadership, right from the Governor all the way to the Commissioner of Health, the Executive Secretaries, and the polio and routine immunization teams at the State Primary Healthcare Board. Today, I want to recognize another major feat that is going on in Kano State. Only about 2 weeks ago, I understand that Kano State has now mapped out the strategic plan to roll out the Community Health Influencers, Promoters, and Services Program. These are individuals, ladies, who are going to be rolled out in your communities that will be there to provide basic health care in your households. This is unprecedented, and you should please give another round of applause to the leadership of His Excellency. But beyond the leadership provided by His Excellency, the whole concept, the turning point in rolling out health workers that will live in your communities and will be there to make sure that kids get treatment for malaria, be able to screen for hypertension, for diabetes, young women who will be identified by traditional leaders in the communities, ensuring that these so-called chiefs agents become a reality is because the Honorable Minister of Health, Dr. Osage Enarire, ensured the finalization of the concept, and today it is a reality. Please give him a round of applause for his leadership. I want to assure you that yes, there are many statistics that shows that we're doing very badly when it comes to maternal deaths, when it comes to child deaths. But at this point in the life of Kano citizens, at this point in the life of Nigerians, there's never been a better time when all the stars are aligned, all the resources are aligned to provide better healthcare for all Kano citizens, better healthcare for all Nigerians. So it is a great time to be alive. Why do I feel so confident that it is a great time to be a Nigerian? For the first time in our lives, Mr. President and the National Assembly worked together to appropriate 1% of the Consolidated Revenue Fund to provide healthcare, basic healthcare for all Nigerians without discrimination. So in the nearest future, you're going to find a situation where you can walk into a primary healthcare center, pay little or next to nothing, and you will get basic quality healthcare that will change the outcomes. This is unprecedented, and I would like you to appreciate Mr. President and the Honorable Minister of Health and the Executive Governor for this leadership. One of the biggest problems that we face in the health sector, and I know that each and every one of you has experienced it, is that when you are sick, you are worried about making a decision about going to a hospital, or if the money in your pocket is enough for transport, for feeding. With the Basic Healthcare Provision Fund, with the contributory scheme of the NHIS, these types of decisions will be very easy in the future, because the Honorable Minister of Health has pulled together all the agencies, all the gateways to make sure that we revise the Basic Healthcare Provision Fund so that you get the quality of services that all Nigerians need. In the next few months, I will come back to Kano State, and I want you to ask me how far we have gone. I am sure that you will not have to ask me, because you will be telling me what the Federal Ministry of Health has done, what the Kano State government has done to improve your health. On the revitalization of primary health care in Nigeria, the federal government, working with the state government, development partners, the private sector, has either constructed or renovated over 4,000 primary health care centers. In Kano State, we are aware that His Excellency has earmarked one primary health care center per ward to be renovated, equipped, and ensure that there are human resources that will provide the kinds of services that you have always yearned for. So what is your role in this? Your role in this is to continue to advocate for primary health care. And like it's been said, it is important that all followers pray for our leaders. So I will enjoin you to continue to pray for His Excellency, the Executive Governor, for the vision, for the passion, for the motivation that he has for all citizens. I have a paper here that I'm supposed to present, but in case of time, I want to wrap up my remarks by today is an auspicious time in the life of all Kano State citizens. In the next 4 months, as we ramp down and close out on polio, we have to think critically about what next. What is the next big thing in Kano State? What is the next big thing in the health sector? The funding for polio eradication from the global community is ramping down. This is an opportunity, a compelling vision for primary health care in Kano State. A Kano State where no child, no woman, nobody goes without good quality health care. With this PHC summit, we have an unprecedented opportunity to look at how we can convert very, very important human resources. Your Excellency, it's very, very critical that in the next few months, in the next few years, that all of the human resources that are currently domiciled within the polio program are now streamlined into the government and the civil service of Kano State, both at the state level and the local government areas. The global partners will not be able to support all these resources coming from the World Health Organization, UNICEF, CDC. So we have to think together about how some of these best trained partners, some of the best people that we have in Nigeria now start working within the state government and help our delivery system, help in execution. As I leave this stage, I want to leave you with a clear vision for the future. The clear vision for the future is very, very different from what has been in the past. We have to move away from pessimism. We have to move away from saying no. This administration, I'll assure you, has the interest of the people at heart. And together with the Federal Ministry of Health, together with the Kano State government, we will pool all resources to make sure that Kano State citizens enjoy the best possible health care that they can get anywhere in the world. I thank you very much. God bless you. Assalamu alaikum.
Thank you very much, sir. Another round of applause for the Executive Secretary of the NPHDA. Ladies and gentlemen, on this note, I will invite His Excellency, the Executive Governor of Kano State, Dr. Abdullahi Umar Ganduje, for his remarks. Your Excellency.
Please sit down, sit down. Azauna, Azauna, Azauna. A'udhu billahi minash shaitani rajim. Bismillahir Rahmanir Rahim. Alhamdulillahi Rabbil Alameen. The Honorable Minister of Health, a friend to the people of Kano State, Dr. Osagi Ehanire, representative of the Right Honorable Speaker, Kano State House of Assembly, the Secretary to Kano State Government, members of the State Executive Council, and the head of service, Executive Director, National Primary Healthcare Development Agency, our another good friend to Kano State, Dr. Faisal Shaib, the Chief Medical Directors, Chairman Governing Board, State Primary Healthcare Development Agency, that is the Salking Yaki, polio, and the other health issues. Alhaji Wada Aliu, Salking Yaki, District Head of Ajingi Local Government in Gaya Emirate Council. The Executive Secretary, State Primary Healthcare Development Agency, development partners, thank you for your assistance and your goodwill messages. Resource persons, esteemed participants, other distinguished personalities, members of the press, ladies and gentlemen, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. It gives me immense pleasure to, on behalf of the entire good people of Kano State, welcome the Honorable Minister for Health, Dr. Osagi Emmanuel Ehanire, to the Kano 2020 Primary Healthcare Summit, which heralds a significant milestone in the Kano State health care system. Kano is indeed home to you as always, and you are forever graciously welcome. We thank you very much, Honorable Minister, for gracing this occasion at this very busy time despite your tight schedules. Our gathering here to discuss this important component of health, which is the primary health care system, further reinforces our conviction that the welfare of our people at the grassroots is at the corner, at the core function and focus of the primary health care systems.